Hi, I'm Dr. Sherman Silber from the Infertility Center of St. Louis here in St. Louis, Missouri. And we have Stacy Farrow here, who's one of our exciting ovary transplant patients, cancer survivor, to tell her story of fertility and cancer.
Yeah. So I have a long, detailed story, but it all started back in late 2009, early 2010. I had just gotten married. I was building a house with my husband, and I had been having headaches for a few months. I ended up getting an MRI and found out that I had a brain tumor, which at the time I was told was benign, and so I was just ready to have the surgery and get rid of it and move on.
But it was still a pretty big deal to find out.
I mean, it was a big deal.
A brain tumor.
Yeah, but I just kind of had the outlook on it that we were just going to take care of it. There was going to be a treatment, and I would get back to my normal life. So that's kind of how the plan went at first. But unfortunately, when they did the surgery, well, fortunately, everything went well, and they were able to get the whole tumor. Unfortunately, at that time, they determined that it was a malignant tumor, which they defined as a medulloblastoma, or peanut tumor, which is actually a really rare tumor in adults. I was 29, 30, just turning 30 at the time, and this is a tumor that you commonly find in kids, but it's pretty rare in adults. So it was pretty shocking.
Wow, yeah, that is scary. And it was on your honeymoon?
Pretty much, yeah. We got married in September, and I think we found the brain tumor. We found the tumor in November, and then we found out it was malignant in January. So then all the treatment plans started.
Wow. And wait, what did you say? You knew you were going to be become sterilized by your treatment.
Yeah, so once we found out it was malignant, we had to go through the whole process of finding out what the treatment was going to be. And for me, even though they were able to remove the whole tumor and there really wasn't any sign of cancer per se, it was a grade 4 tumor, so this type of tumor is very aggressive, and so the treatment recommendation was 6 weeks of radiation and then almost a year of chemo. I was told at that time that if the radiation didn't make me sterile, that the chemo probably would.
Did you lose your hair?
I lost all my hair, yep, arms even, eyebrows, everything, for a while, because that treatment plan was really long. So I fell out during radiation and came back a while probably after the chemo. So over a year with no hair.
What was it like going to menopause?
That's horrible. I'm sorry for anyone struggling with menopause. I feel so sorry. It really is horrible. It's just that you can't sleep, you're sweating, your hormones, I guess, or lack of hormones are making you crazy. It's really difficult, especially when you're younger and you're not mentally prepared to deal with this.
Yeah.
So luckily, when I got the diagnosis that it was cancer, and I met with my oncologist early on, before the treatment started, they referred me to you. Yes. And so then I had the opportunity to meet with you and find out what my options were.
That's great. Most oncologists, even around the world, we talk about this at our scientific meetings all the time, don't refer their cancer patients for fertility preservation.
Yeah.
Because they really only can think about saving their life. So.
Absolutely. Yeah, I find that it's really rare. There's a small community all over the world that I've found of adult patients who've had medulloblastoma. And it's really actually sad. We actually have a Facebook page for we talk. And it's really sad because by the time they make it to the page, they've already usually started treatment, and then they've missed that opportunity to have something like this.
That's what usually happens.
Yep. I was really lucky that I had that opportunity and was given that information, and that in the midst of all that, we took the opportunity. We came in, we could have just focused on the treatment as well, but we were open-minded to, still hopeful, I guess, that something would be possible.
I just have to ask you because I honestly don't remember.
Yeah,
where was your oncologist? I mean,
at St. Louis University.
So St. Louis, they should deserve some credit for
Dr. John Richard.
For referring you for fertility preservation, because that's really many of the, I don't know, you can tell us what you thought, but many of the young cancer sort of survivors that I've talked to in their 20s say that they could deal with the diagnosis of cancer because when you're young, you figure you'll survive everything. You're eternal, you know. And they weren't worried about this, but they went into tears when they
That is so
thought
funny
about
that
their
you
fertility.
mentioned that. I can't even believe you brought that up, honestly, because through the whole process of finding out that I had a tumor and then finding out that it was malignant and then going through everything. So I was in the hospital from the surgery. I had this great positive outlook the whole time. And I don't even know that I cried when I found out it was malignant. But when I found out that I was going to have to do this long steroid taper and that I wasn't going to be able, I think my goal at that time before I connected with you was to just like try to have a baby really quick or something.
Yeah, hurry up and have a baby.
And when he said that, you know, that meant I couldn't try to get pregnant or anything, that was the first time I cried, was that I was never going to be a mom. You know, it was like a realization that I didn't realize I didn't need to have yet.
And that's interesting emotionally because you wouldn't think about that. But I mean, I was shocked by that too over the course of many years. We first started freezing ovaries in 1996, but I really didn't know that it was ever going to pay off. It just seemed like it's the only chance they have. And I got always that story that's what young patients, at least with cancer, were most concerned about.
I talk a lot about my experience, and that's one thing that I don't think I mention very often, so it is interesting that you brought it up.
And I ask you this too, because now you're 38 years old, and I've talked to several patients that say they're really glad they had cancer because they don't worry about their biologic clock because their ovary tissue has been frozen. So that's weird sounding also, but they feel very comfortable. You've got a 30-year-old half an ovary still in the freezer, right?
I know. Yep, I know.
And you're still functioning at 38.
It takes a lot of pressure off. I mean, I have to say, I can only speak from a woman's perspective who did this because she had cancer. I mean, I'm married. It's my perspective. But there's definitely a pressure off your shoulders when you think you have this extra time. Even now, like even after I've been lucky enough to have this baby, and maybe I should be like, punching the gun to have another one. I think in the back of your head, you do have that level of comfort where you're saying, well, I still have that tissue frozen and, still kind of young.
It's nice to have a 30-year-old ovary frozen if you finally decide to have another child when you're 40, and 40-year-old eggs aren't as fertile, of course, you know.
Yeah.
But, of course, even when you're 40, if I have my arithmetic right, the ovary that's still in you is only going to be 36, right?
Yeah, so is that right?
Yeah, I think so. Because, so you still have a relatively young ovary.
I do, yes.
But I guess let's say we wait till you're 45. For sure, the ovary you have left isn't going to be so great, but you still have a young ovary waiting.
Well, and that's the amazing thing about even the ovary that the tissue that you put in now is originally when we started this, we thought the tissue might only last, because I had a very low follicle count and a smaller ovary. We thought that the tissue might only last 6 months to 2 years. And I don't know if you just told me that, so
I thought the max
get
would be
busy
2
with
years.
the baby making or what. But, it's been 4 years. So, I'm not in menopause. So that alone is a celebration.
I think it's going to last a long time. I wasn't really aware of this back then in 2013. But now we've studied it, and we've found that the lower your ovarian reserve, the lower the number of eggs remaining, the slower the rate of primordial follicle recruitment, which means your ovary has a mechanism for saving your eggs when your number of eggs goes very, very, very low. And so let's say, a woman has one ovary removed when she's young for any reason, not for cancer, just maybe she had a cyst or some problem. Her menopause is only going to be 1 year earlier based on losing half her ovarian tissue, half of her eggs. So the ovary has a mechanism for slowing down the rate of loss of eggs. So you don't have a lot of eggs, but they're good eggs, and and they're being preserved by that mechanism. So that's why these ovary transplants are lasting way longer than we thought they would.
It's amazing.
Yep. We have some lasting as long as 10 years, and then they have extra ovary tissue still frozen in the bank.
Yeah.
So one doctor from Denmark, who I love, Klaus Andersen, who's done a lot of work on this, he actually makes the argument that maybe it would be good for a woman to have her ovary removed, one ovary removed anyway, and then put back a little bit of tissue maybe every 8 years, and then it'll last till she's 100 and she'll never go through menopause or need
I can tell you,
hormones.
well, younger women might question this.
Yeah, I mean, it's outrageous.
Older women would
but
probably
it's
sign up
interesting.
right away.
It's interesting. So you're not going to do that unless you had cancer. You know?
Or been in menopause. Yeah,
Yeah,
you would
right.
definitely, you might not be able to do it, but you would want to at that point.
Right,
Yeah.
exactly. And it sounds extreme, but boy, I mean, that's what's going to be available
Yeah.
to you. Yeah. So I think it'll last for a long time. And there's something else you learned from your case we talked about. If a couple is trying to get pregnant, should they time their intercourse, or maybe you can tell us what you learned from that? I have my views, of course. What did you learn about?
So I am a clinical laboratory science or a medical technologist, and I'm addicted to the data. I want the numbers. I want the lab results. So when we first met, I specifically, once I had the tissue reimplanted, we had a specific talk about don't count anything, don't do ovulation tests, just go home and have a healthy marriage. You know? And I think there was a schedule in there somewhere about frequency that seemed a bit
No less than
challenging.
3 times a week.
But I couldn't help myself. And about 6 months in, I think I started tracking the chart and the temperatures and a couple of maybe ovulation kits thrown in there. And after a couple years, I guess it was a couple years, almost, I was pretty bummed because it just wasn't happening, and I was starting to have a lot of stress about it. And
You were trying to time everything.
I wanted to understand how it worked, and I think if there's nothing I've learned out of not just the ovary tissue freezing and reimplantation, but the cancer process as a whole, is it's better if you don't try to control things. Just let them happen. Be smart about it and let them happen. So as soon as we were about to give up and we decided to give it one more month before we did another surgery, and I stopped all that, I got pregnant in a month. So.
And your baby is how old?
2, just turned 2 last week.
How's the baby doing?
He's amazing. He's awesome. He really is. I kind of joke about this, and I shouldn't joke about it because I feel bad putting it out in the universe, but sometimes I'm nervous about having a second one because this one's so good. Like, he sleeps well, he eats well, he's pretty well behaved, so... I mean, I guess at 2, maybe I'm not privileged to say that yet, but so far, so good.
I think everything important happens in those first 2 years of life.
Yeah.
But that's a different program. But I think you've done a great job then.
Could not have done it without you, and I just appreciate not only having the opportunity, but the fact that you're taking the time to research this. I mean, another big thing that, people run into is insurance, and there's a lot of different places in health care that this comes into, but insurance can be a big problem for fertility treatment, and it's a shame. It's a
and this
shame.
should really be considered a complication of cancer treatment, and so it should be covered by insurance. Insurance companies are not doing it, and we have over a 75% pregnancy live baby rate with these cases, so it shouldn't be called experimental.
Right.
And yet the medical societies call it experimental because it sounds so outrageous. But it's really easy to do. I can tell you as a surgeon, this is not difficult surgery, and the freezing is easy to do. It was just an innovative idea, but it's easy to do, and it shouldn't be experimental, I think. You're an example of that.
Yeah.
Well, one thing, a point comes out of your case is so many couples, when they're trying to get pregnant, will try to time their ovulation and let's not have sex, let's save it up. And it's a $2 billion industry, these ovulation kits. And it's worthless. The egg will last about 8 hours after you ovulate. sperm are going to be good for 3 days after intercourse in the female's tract. So you just want sperm there whenever you do ovulate, and it's really hard to be sure unless you're doing IVF when you ovulate. And then if you're doing IVF, well, then you're not doing spontaneous pregnancy. Problem with IVF with an ovary transplant is we've studied this, and you get very few eggs. So you're going through a lot of treatment, a lot of expense, and you might get one egg instead of multiple eggs, and so the results are really not good with IVF. But if you just have regular intercourse and a happy marriage, you get pregnant eventually and have a baby. It's over 75% really, and that's really pretty similar to the population average that haven't gone through all this.
Yeah.
So I recommend to couples that are trying to get pregnant is don't fool around with time of your intercourse or intrauterine insemination, which isn't as good as intercourse. And if there's an infertility problem, okay, then you do IVF. For these cases, I've found IVF isn't as reliable as just having intercourse 3 times a week or more, if it's not too burdensome.
I plead the fifth. I'm not saying anything.
Okay, so I think that the message here from Stacy is that there's several messages, but one is if you have cancer and you're going to undergo chemotherapy, and I think 1 in 250 adults now are cancer survivors of young cancer, and you can preserve your fertility. I guess, how long does that delay your chemo? I mean, when were you?
It really didn't for me.
Didn't delay.
So I was actually waiting on a radiation start date anyway. So I didn't start the radiation until April anyway.
Yeah.
And I had the surgery in February. So there was no delay for me because it actually, once I saw you, it was like the next week that we had the surgery. So.
And I think, how much pain was it? When could you have had chemo if they wanted to do it? How soon?
There was no pain reason not to do it. I don't know if they would have a medical reason or not. There's none that I know of. Yeah. There's none that I'm aware of.
So we could have started it if they wanted to very quickly in a few days.
To be honest, after you get chemo, you're just sitting around anyway. So the medicine probably helps.
Well, because that's a big message is fertility preservation.
Yeah.
Another interesting message is really that it's not so smart to try to figure out and get too nervous about getting pregnant and time your intercourse. That can have a negative effect, and typically you can be you could have ovulated before you wind up having sperm in the female tract. But if you've gone for a period of time without getting pregnant, or you're getting older, then okay, then go to IVF. I obviously am in favor of that, but I don't think that if you're short of IVF, that you should be fooling around with these other approaches. They just
I think it just adds stress. You know, it just adds stress to the process where there's already stress, especially for people who have been trying and haven't had luck maybe. So if you just kind of take that out of the equation and just focus on the healthy marriage and that goal, that really, I mean, it's at least a place to start, you know.
Well, okay, this is great seeing you again and chatting. And if you have any questions, we're not live, but if you have any questions, you can always go to infertile.com or call us up in St. Louis, the Infertility Center in St. Louis. Happy to answer any questions, and you can go to the website. And I think you can, if I'm not right, I think we can even see you somewhere on the website, somewhere, I think.
I think so, yeah. Maybe a couple places.
Yeah.
Or on your
you have
Facebook
your own
page.
Facebook page, don't you?
I have one just for Medulloblastoma people, yeah. So it's public, but for anyone with a brain tumor, you know. But your Facebook page would be, if you know, I'm on your Facebook page a lot, so I love to hear the stories. I mean, I wish I knew more. I had a more organized chart. I mean, it's always interesting to know what number you are in all of this process, and it's really exciting, honestly. It's really exciting to be a part of it, to think about how many babies have been born this way and to know that your son was one of them. It's so special.
And we didn't know 20 years ago when we started doing this if it was going to be successful. But it really is very successful,
Yeah.
obviously.
Can attest to that.
Okay, thanks a lot.